What labs and what biomarkers and what studies should I have done to make sure that I'm healthy? I get asked that question probably more than anything else out there. So what I'm gonna do is give you the whole list from simple to hardest, to from the wearable things to the labs to the technology that you need to know where you are to help assess your health and know how things are going. So first things we're going to go through are the basic lifestyle markers that you should know when you're trying to assess your health. It's not just about labs, it's not just about what your blood sugar is, it's about knowing how well you're doing with your lifestyle. Things that you maybe not hear as much from your doctor, or maybe not as cool to put on social media. You want to try to be assessing your REM sleep and your deep sleep. That is, your deep sleep is when your hormones are being regenerated. That is when your hormones are being boosted. That is when your inflammation is being improved. You want to make sure that you're optimally getting 25% of your time sleeping is in deep sleep. The more importantly is that you should be getting at least 90 minutes. If you're going to bed late, you may be losing some of that. You also want to make sure that your REM sleep is also about 90 minutes. Your REM sleep is where you're able to dream, and it helps your body with memory and cognition. So if you're losing your REM sleep, that is going to happen. So that is one important variable that you should be looking at in terms of just general health. Second thing that we always do, and it's something very simple and it can be done, a lot of doctors should be doing it who aren't doing it, is grip strength. It's something that can be done for something you can get for $50 off Amazon. We know that your grip strength has now not only been linked to your longevity. Patients who have lower grip strength have lower longevity. That's been proven. Rapamicin's not been officially proven. Spermidine's not been officially proven. Metformin's not. But we know that there is a link between grip strength and longevity. We know there's a link between your grip strength and your physical fitness. So that is something that should be worked on. That is something you should know what it is so you can track that as time goes on. Other things that you want to be looking at, and these are things you could be doing in shorter spurts. You can get a continuous glucose monitor once or twice a year, do it for 2 weeks, making sure that you're not having spikes greater than 40 or 50 points. In terms when you're eating certain foods, make sure that you're not having huge spikes when you exercise, making sure that your sugar is not going below 70 when you fast or exercise, that you are torturing your body too much. That is something that you can do. A little lower in the list, but something you definitely want to be doing. Making sure that you want to at least know what your heart rate variability is if possible. Heart rate variability is a balance between your parasympathetic and sympathetic nervous system. It's the variation in your heartbeats, for a simple definition. And we're not just looking at a hard number, because there is no set hard number for anybody. We want to make sure that there is a gradation throughout the day. We want to make sure that you're not sitting at 52 all day. You want to see you're at 42, and then you're going to 120, and then you may go back down to 60, and so on. That is almost as important as what that hard and fixed number is. It's great if your heart rate variability is in triple digits, but not as much concerning as if there's just no variability, where you have pretty much a flat line on whatever app that you're using. Another thing that we want to be doing in terms of daily lifestyle data is looking at your visceral fat. Your visceral fat is very important. It's what unfortunately has an increased cancer risk, can lead to abnormality in hormones. It can lead to inflammation. It can lead to a lot of different things. So it's something that you want to know what it is. Visceral fat is the fat around your organs. It's the fat sometimes that you just can't lose sometimes. There are a lot of cool devices out there that can give you an idea what your visceral fat is. And what your body fat percentage is. I mean, the gold standard, the thing that you can be doing, it's pretty cost effective right now, is getting a DEXA scan. Again, no set number. We like you under 20%, but again, no set number between what the body fat percentage is in your health. It's a combination of a lot of different variables that are out there. So in terms of lifestyle, we want to know how well you're getting your deep sleep. We want to know what your grip strength is. We want to know what your visceral fat percentage is. We should know what your heart rate variability is. That's a great starting point for other things that we're going to talk about. Next thing we're going to talk about the heart. The heart powers everything. If you don't have the heart pumping, not doing too well. So, I mean, there's so many new things that have come out over the last year or two, both in terms of the technology side, as well as in terms of what labs we're looking for. So in terms of the lab work, If your doctor is still just doing a traditional LDL, HDL, and triglyceride panel, time to switch doctors. That's not the gold standard anymore. It's not the biggest risk factors anymore. It's not giving you the best idea of what you should be looking at. What we're looking at are a lot of different things now. We are looking at cholesterol carrier, something like an apolipoprotein B. That actually now has been shown to be the greatest risk for cardiac disease of anything that's out there. We want it less than 90. Anything greater than 90 is very concerning. It can sometimes be lowered by diet. There are medications out there from statins and some antibodies are out there that can help, but you want to make sure that your doctor is getting an apolipoprotein B on you. You want a lipoprotein A, another cholesterol carrier that needs to be evaluated as an increase of cholesterol, and if elevated, needs to be treated. Other things we want to be looking at now is you want to be looking at an OMEGAQUANT, which is a characteristic of your omega fats, your omega-3, your omega-6. You do not want to have an elevated omega-6 ratio. That is an increased risk for heart disease, and that needs to be dealt with. You want to be getting not a traditional cholesterol panel like I just talked about. You want to make sure that you are getting what's called an NMR lipid panel. There's different names for different lab companies where you're getting the particle number, which depending on is usually around 11 or 1200, you don't want to be above. You want to make sure you're getting the particle size, especially for the LDL. We want to make sure we get concerned about the small, dense LDL. Those are the particles of cholesterol we tend to be more concerned about in terms of leading to heart events and strokes. Those are the numbers that you want to be doing. Apolipoprotein B, lipoprotein A. You want to be looking at a small dense LDL. You want to be looking at a particle number and a particle size of LDL. You also can look at other things that are out there. You can look at oxidized LDL, which does give you some information. You can get an AMDA, which gives us some assessment of the nitric oxide levels. We now know that the decrease in nitric oxide can lead to heart risk. So those are all things that can be done should be done to evaluate your heart. You can even go to the next level and get what's called the CIMT to help evaluate your carotids and evaluate the endothelial level, which is the tissue level of the blood vessel. If that is damaged, that can be concerning. There are medicines out there now for that as well. One of them is something called arteriosil. There's other medications out there that can help heal your endothelial levels. You also can now get really cool CAT scans of the heart and the vessels that will give us an idea how much plaque is there. You'll get initially what's called a calcium score. That's the lower level test. Just because you have a 0 calcium score does not mean that you have no risk for heart disease. That is not true anymore. The more advanced test is getting what's called a Clearly. A Clearly test is where you're going to get your traditional coronary CAT scan done, and then they're going to put it through an AI system, and that is going to be able to look for soft plaque, which is the more concerning cholesterol. So that is really what we're looking at in terms of what tests should be done to evaluate your heart. And in terms of looking at the structure of the heart and making sure that we're looking at the cholesterol, you also want to potentially get an idea. You can do a nitric oxide test to see your levels of nitric oxide as well. ADMA is part of that. And then you can even go further down the rabbit hole. For this discussion, those are the things that you want to be concerned with. In terms of the brain unfortunately is not as easy to assess. I mean, there are some people who will get either a SPEC scan or some people get a QEEG. Both can give you some assessment in terms of brain function. There is no perfect brain test right now that is easily available that's going to give you all the information that you need, and they can also be costly, but if you want to do the full evaluation of your health, it can be very helpful to look at. So we talked about the heart, we talked about the brain. Now we're going to talk about your workout capacity. If you want to really kind of go through the full program, you do want to get a VO2 max, resting metabolic rate. A VO2 max is the maximum amount of oxygen that your body is producing during exercise. Something that can definitely be evaluated. You can do exercise to boost your VO2 max. You also can figure out what your resting metabolic rate is, and also find out if you are a more predominant fat burner versus a carb burner. You want to be able to easily burn fat as well as carbs, and you want to be able to switch back and forth. That's what's called metabolic flexibility. There are tools out there, something like a Lumen, which is okay. And then again, you could do a full cart workup at a physiologist's office. A lot of gyms are offering it now. It's something that you definitely want to look at in terms of general health. We talked about workout, we talked about the brain, we talked about the heart. Now we're going to go to the question that we always kind of get asked in the basic part of everything else. What other labs should I be looking at to really, really assess my health? And here we go. So we're going to go, besides the cholesterol stuff that we already talked about, you need to get a comprehensive metabolic panel. That is going to look at your sugar, it's going to look at your kidney function, it's going to look at your liver. It's going to give us a lot of basic information. You also would like to get a cystatin to help evaluate kidney function. That's the first piece. You also want to get a CRP, which gives us an idea of general inflammation throughout the body, which is concerning. And those are things that are not only going to tell us inflammation of the body, but also inflammation within the heart is concerning. Other things that we definitely want to look at is we definitely want assessments of your hormones. If you're male or female, doesn't matter in most of these cases. You want to get a free and total testosterone. Free testosterone is the testosterone that's floating around your blood. Total is the combination of what's floating around in your blood, plus what's bound to what's called your sex hormone binding globulin, which you can think of as a DOC. So it's great that you have testosterone or whatever hormone also binds your thyroid and estrogen. But it's great to have hormone bound to that DOC. But if it's sitting there at the DOC, it's like a boat at a dock. It's doing absolutely nothing. So we look at both numbers to get a full evaluation of how your testosterone is, and men and female both need testosterone. And we're going to want to get a fasting insulin level. We now know that patients who have high insulin levels can lead to Alzheimer's, can lead to diabetes, and that because you become what's called insulin resistant because your body does not use insulin as well as it should be. So we get concerned. So you want to get a fasting insulin, usually done before 9 o'clock, to get a much better evaluation of what your insulin levels are. We want to make sure you're getting a full thyroid panel. A thyroid panel should consist of a total and free T3, a total and free T4, as well as a TSH. You're looking at the whole package. If your doctor's just looking at a TSH, like I talked about with cholesterol, run away. They're not getting the accurate data to really make an assessment of what your lifestyle is. Those are things that we want to look at. You want to make sure that you're getting at the DHEA level, DHA-S. That is a precursor for testosterone, helps with estrogen production as well. You need that in both male and females. Other tests that we want to look at are uric acid, which has recently been linked to heart disease, as well as most people know it because it's related to gout, but it's also now been related to diabetes and potentially heart disease, so an elevated uric acid level will be concerning. A couple other tests that everybody should be getting would be a vitamin B12 level. B12 is definitely linked to many medical conditions that you want to make sure that you're at appropriate levels. I mean, B12 is water soluble, so loading up on it is only going to last so much because it will be urinated out, but it's good to know. You want to know what your vitamin D25 hydroxy levels are. We know more and more of how important vitamin D is in terms of muscle growth, in terms of brain, in terms of sleep, in terms of working out. You want to make sure your vitamin D levels are appropriate. You're going to talk to 10 different doctors. You're going to get 10 different answers of where your vitamin D should be. I prefer it to be above 50. The levels will say above 30. One of the two other tests you definitely want to look at, an ANA with a reflex would mean that it'll go to, if it comes back positive, will show other things. Will be assessment of autoimmune issues. You want to get a homocysteine level because that's an assessment not only of a cholesterol marker. If that's elevated, we get concerned regarding Alzheimer's, infertility, and other issues. It's something that should be part of your panel. A couple of things that we tend to look at are IGF-1, which is a measure of your growth hormone, as well as IGF-BP3, again, another measure of your growth hormone we use for muscle growth, brain function, helping with deep sleep, which we talked about in the beginning, how important that is. So that would be a comprehensive lifestyle evaluation. There's deeper dive things that you can add on to that. I mean, people are now doing genomics, and they're doing biological age testing, which haven't been fully proven yet. They're doing full body CAT scans to assess for cancer. Those are things that you could add on. They're expensive, but they definitely are there. But everything else that I mentioned previously are the things that we're really looking at and the tests that you should be looking at to help make sure that you're living the best life. Stay tuned for more on this channel and subscribe below.